Saraniya Kshara Karma and Agni Karma in different conditions like piles, fistula in ana, fissures, rectal collapse, pilonidal sinus, and carcinomas. He has presented and conducted workshops on Kshara Karma and Agni Karma in piles at various platforms. He has worked as a visiting faculty at SDM Ayurveda College from 2001 to 2004, and he has published research articles on Kshara Karma and Agni Karma and different types of piles in various journals. Till now, since 1991, he has done almost 7,500 cases of piles by Kshara Karma and Agni Karma. So he is one of the very apt persons for today's session. So without much ado, I invite you, sir, for this session of Rekha. Welcome, sir.
Thank you. So am I audible?
Yes, you are, sir.
So please share my screen. Allow my screen to be shared.
Yes, sir. I have made the option.
I have it. Yeah. Yeah. Okay. Can you see my screen?
Yes, sir. Perfect.
Okay. Thank you. So first of all, I am thankful to the organizers for giving this opportunity to share my experience in different gastrointestinal conditions. First, let us pray God. Dhanvantari, Om Namo Bhagavate Vasudevaya Dhanvantaraye, Amritakarnahastaya, Sarvamyanashanaya, Taidokyanathaya, Vishnave Swaha. Then I have the blessings of Gurus. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. With the blessings of all Purva Vidyas and Apurva Vidyas. With their blessings, I will start my presentation. Gastrointestinal system. Annavasrotas. So there are three inlets to the body. One is Pranavasrotas, Annavasrotas, and Udakavasrotas. 7 body itself, Rasa Rakta Mamsa Meda Asti Madhya Shukra, and 3 outlets, Mutra, Purisha, and Sweta. That is 13 Srotas. Now, very important Srotas, that is Annavasrotas. Starts from Mukha, goes up to Purisha Srotas, up to large intestine, up to cecum. All comes under Annavasrotas, or we call it gastrointestinal system. So, how it should be presented? Actually, it's a very vast subject. In my clinical practice, what I see, simple way, I will tell a disease, how it should be diagnosed and how it can be treated. With just by oral presentation, then slideshow, I will give my presentations. So in Ayurveda, whatever things are there, we should analyze on the basis of this 3 sutra of Ayurveda, as told in Charaka. Hetu ringa vishadam jnanam, swastha agara parayanam. Patient comes to us with the linga, signs and symptoms. They will not tell what is the disease, how it should be treated. They will tell these are the symptoms, signs, and so we Vaidyas should find out what is its hetu, then give specific treatment on the basis of Karyakarana Siddhanta. In Ayurveda, the logic used for analyzing a cause is the doshas. That is why Sushruta says, Nasti Rugo Vina Dosha, Yasmatani Shakshana Anuktamati. Even it is not told, Doshana link, you have to see where in the Vyadhi, given Vyadhi, in a given patient. Analyze it and give Dosha Vyadhi Viparita Chikitsa, Karyakarana Chikitsa. So coming to gastrointestinal system, as I already said, mouth, throat, esophagus, stomach, duodenum, liver and pancreas, small intestine, large intestine, everything comes under gastrointestinal system. So there is a mechanical disturbance and physiological disturbance. Both will be there, anatomical and physiological. Both disturbance will be there, and you will have different presentations, a vast presentations of different diseases we can see, like Mukha Rogas, Chardi, Amlapitta, Agnimandya, Ajirana, Udavarta, Shula, Gulma, Grahani, Yakudodara, Baddhagudodara, different Udaras, Atisara, Pravahika. So vast diseases, Shula, it's a vast disease presentation is there. So in all Vyadhis, what's Charaka says, Trivida Bodha should be there for a clinician. One, he has to see in all Vyadhis what is the dosha involvement. Second one is Samuthana Vishesha, how that disease dosha as Samuthana, Utpatti has happened, why it has happened. That is Samuthana Vishesha. And Sansamsha, where is a particular place? Is it the Mukha or intestine? Where is a particular place? That is Sthana Samshaya. These three with the Bodha should be there in a given patient. Now, you see, it is Sutsura's time. They used to do all by Anumana, Pramana, all these things. Pratyaksha, Anumana, Upamana, and Shabda. These are four types of analysis you are doing. But in today's practice, in 21st century, we have a contemporary system of medicine that has advanced technologies there to find out where is the Vyadhi. That is specifically, if you utilize the modern diagnostic gadgets, what I feel we can specifically, you can understand where is the Sthana Samshaya. Number one. Number two, Samuthana Vishesha. Most of the Samuthana Vishesha of different Vyadhis we can understand by utilizing modern diagnostic gadgets. Doshas we have to find out according to Ayurveda by science symptoms on the basis of Tridosha Siddhanta. By Ayurveda way of diagnosis, we can diagnose doshas. But for understanding Samuthana Vishesha and Sthana Samshaya in given Vyadhi, we can utilize all modern diagnostic gadgets. I think if you utilize it, you will be very fast in diagnosing the disease and giving specific treatment. Many of Ayurvedic doctors, Ayurveda Vaidyas, they feel modern diagnostic gadgets we should not use, it is not useful for Ayurveda. Many persons think, but as a practitioner, what I feel after practicing for these last 32 years, 35 years, what I feel, if you utilize these modern diagnostic gadgets and analyze according to Ayurveda, where our diagnosis will be very fast and we can give very fast result to the patient. After all, we should give a specific and specific treatment and fast result we should get. That is why it is very useful. For example, I am saying this context of this Anova Srotas. If a patient comes with pain abdomen, if we utilize the modern diagnostic gadget specific Sthana Samshaya, where it is, how dosha will understand. There is a Vata dosha is involved. But Samuthana Vishesha and Sthana Samshaya, you can't understand that much fast without modern diagnostic gadgets. Just in the 21st century, if you utilize what are diagnostic gadgets, just you see what are the possibilities you can have. A Shula in the pain abdomen can happen. From top to bottom, I just you count it. It can occur due to myocardial infarction, a heart attack, a pneumonitis, a case of gastritis, a case of perforation of gastric ulcer, perforation of duodenal ulcer, a case of biliary colic, a case of pancreatitis, a case of intestinal obstruction, a case of intestinal perforation, a case of appendicitis, a case of urinary colic, ureteric colic, and a case of dysmenorrhea. All these presentations will be there with Shula. If you utilize just on ECG, on X-ray, or sonography and CT scanning, within 1 hour, you will specifically where is the disease, you can find out what is Samuthana Vishesha. Both you will find out very fast. Then you can understand if it is a Baddha Gudodara or Parisravudara, surgery is told. If it is a growth, surgery is told for Gulma, what Vaishushat has told. If it is medicinally curable, treatable, you should utilize specific Ayurveda medicines. Or if you have a big abscess, surgery is indicated. Shastra Dharma is indicated. Shastra or Aushadhi, Kshara, whatever treatment needed, specific treatment should be given. Or if it is a very severe, Mastamba if needed a acute case, you can do it, or you can refer the case to a particular person who can do it. So that is why for Trivida Bodha, for any patient comes with the different signs symptoms, if we have this Trivida Bodha, you can give a specific treatment. That is why I am saying, if you utilize these modern diagnostic gadgets, we can treat these cases easily. So there are many cases you can't treat also. Many cases you can treat. But first of all, you should understand, can we treat or should we refer? This is also a service to the patient. A specific treatment can be adopted afterwards. So with this introduction, you say these are the many drugs. I have narrated many drugs, whatever I am using in my practice. Hingvashtaka, Estima, these are all simple drugs, whatever we utilize day-to-day practice. Most of them may be knowing all these. Shamana and Shodhana is usually I do Satyam Hatya Virechana or classical Amana Virechanas and Basti Gisa and Shamana Vashadis. These are all the drugs, Rasaushadi and Kashtaoshadi. Maybe all these drugs we utilize in our practice. So, coming to specific diseases, first in the mouth, usually there will be mouth. One is ulcers will be there, Mukha Roga, and there may be growth, there may be infective ulcers, there may be degenerative ulcers, there may be allergic ulcers. These are all possibilities are there. For anything, any vyadi may happen. First, you have to see which dosha is involved. If involvement of Vata dosha is there, there will be pain, Shura will be there. Involvement Pitta, there will be Dam. Involvement of Kapha, there will be Ghanatva will be there. So there may be Ekadosha, Didosha, Sanipata, presentation may be there. And Samuthana Vishesha you should see. Is it Dhatukshaya Vata degenerative or Avarana cancer? Ekadesha usually it occurs into Rakta Avarana pathology. Usually there will be a Sparshadvesha, tenderness will be there to the patient. And Kapha Avarana, when there is a growth, that may be there in Rakta Avarana, Rakta Dushti by Ahara Vihara. Maybe Rakta Dushti or by Krimi or by Abhigat. All this can happen. You will have Mukha Roga and specific Chikitsa should be done. Definitely, if it is a growth, you should do the biopsy and find out is it a malignant or non-malignant. And the Shastra Kshara Agni Beshaja, this line of treatment as told. But it's the infection, Krimi is there, Krimi Prakriti Ghat Chikitsa should be done. Or Apakarshana, that is Panchakarmas, Shodhana Chikitsa. And Nidana Parivartana. Krimi Chikitsa, definitely there is a specific treatments are told in Ayurveda. If very severe infection is there, specifically a bacterial infection, you may need modern antibiotics. You can refer this case. If it is viral or this, you can utilize Rasayana Chikitsa of Ayurveda to get a good result. And allergic or degeneration, specific Vata dosha or Pitta Kapha dosha, like this specific treatment. Usually, most of the patient comes with the Vata Pitta Lakshanas, pain and burning. I usually use Sutta Shekhar Rasa, Amadrit Mukta, and Amaraki Churna, Estimadu Churna mixture with honey and sugar. Because when Pitta Samsarga is there, honey mixed with the sugar it will be very useful. Only honey, if you use it, becomes Ushna. So for Amaraki Churna, if mixed with honey and sugar, it becomes Pitta Hara. Patient gets very fast result. Within 2 days, you can get the result. For a growth, etc., we can use Kshara Karma in such conditions. Specifically, maybe maybe a pre-cancerous stage, definitely we can adopt Kshara Karma. Pratisarani Akshara, what I am saying, not Pani Akshara. Pani Akshara also can be given. Then coming to if it is a degeneration, Gruta should be adopted. Specifically, I use Gruta is a Shatavariyadi Gruta in such conditions. It is a Vata Prakopa, Rukhana will be there. Madhura Ganavashadi Gruta, Shatavariyadi Gruta, it's wonderful drug, conditions. And in the throat also, any condition, if it is infection, as I have told, the same treatment protocol can be utilized. Same drugs. I think more than that, no other drug may be needed. In throat, sometimes acid regurgitation may come to throat. Patient comes with the burning sensation throat. Such a patient comes to us in OPD. Then you have to give chikitsa, Udavarta Hara chikitsa should be done. I think Udavarta is discussed later. Same chikitsa should be done. This specifically when the burning is there, Pitta Hara Vatanduloman chikitsa. That should be done. If it is Ajirana chikitsa should be done. Specifically, cases of what I see, that hernia will be there, hiatus hernia. So many patients comes with hiatus hernia with regurgitation, ERD condition. They come with the burning sensation. Throat, if you see his throat, you can see the pharyngitis like or reddish ulcers. Such conditions you have to utilize Udavarta Hara chikitsa. Anuramana chikitsa. You can utilize, if it is Kevala Vata Vittaja, utilize Avipattikara Yashtimadu. If it is Kapha Vittaja, utilize Vaishwanara Churna. Such condition, or Vata Kaphaja. Vaishwanara Churna, if you utilize. That will be Anurama and Skuta Shekara and Kamadu Mukta. Skuta Shekara Rasa and Kamaduda with the Mukta. Mukta Yukta. Because Pitta Samsarta will be a Pitta Lakshana both. That is why this Trivida Bodha, Dosha Bodha is very important and give specific treatment. Coming to esophagus, again, one is presentation usually comes with the growth. A squamous cell carcinoma or columnar carcinoma, growth or normal, some growth in the esophagus. That will be obstruction. Naturally, patient comes with deglutition problem. And special treatment for growth should be done. Anyhow, it is really difficult. It's a marmasthana. Surgical excision will be very difficult in such cases. A marmasthanaja, any arbuda, it becomes asadhya, as told in Sushruta. Tell the patient asadhyata, then you can start your specific treatments of Ayurveda. What is Arbuda Chikitsa should be done. In Arbuda, the treatment told is Shastra, Kshara, Agni and Beshaja. For growth, I think it holds good for all the growths in the from top to bottom. Arbuda Chikitsa is one is Shastra Karma. If possible, always you do the Shastra Karma. If Shastra Karma is not possible, or after Shastra Karma, Kshara Karma and Agni Karma, Pani Akshara, Pratisarani Akshara, and Agni Karma. Nowadays, in Western medicine, they use chemotherapy and radiotherapy. Chemotherapy is nothing but a Pani Akshara type of treatment, whereas because killing of the criminal that cells with some drugs. And Agni Karma is a burning. Now they do it by radiotherapy. Anyhow, in Ayurveda procedure, it is not possible. It's advanced technological procedures. The principle is told in Sushruta. And the last is Besha Chikitsa. In Besha Chikitsa, two types. One is to reducing growth, another one is Rasayana Chikitsa. That is why Sushruta says, Rakshet Balam Chapi Tadrakshitam Vyadi Balam Nihanti. So if you do Rakshana of the Bala of the patient, Tadrakshita Bala itself reduces the Bala of Vyadi. Tadrakshita Vyadi Balam Nihanti. Vyadi Balam will be reduced. That Rakshita Bala, increased Bala, that is the Rasayana Chikitsa. In Western medicine, they call it as immunotherapy. By these drugs, if you increase the immunity of the patient, that Rakshita Bala itself reduces the Bala of the Vyadi. This is the specific treatment told in the Sushruta. Rasayana Chikitsa is there. This Rasayana Chikitsa again Dosha Viparita or Guna Viparita Rasayanas are there. If it is a Kapha Pradhana Vyadi, Kapha Hara Rasayanas. Specifically in Arbuda, we have find out one is the Gomutra Rasayana and Ballataka Rasayanas and Bugula Rasayanas. These are very specific drugs, and other Rasaushadis are there. Malla Sindhura or Makaradhwaja and Swarna Bhasma, Vajra Bhasma. These are specific Rasayanas. Definitely we can utilize. Hypothetically, I can't say you give this drug for this Arbuda, you get result. It is not possible because each patient comes with any growth. They present with different signs and symptoms. We analyze that signs and symptom, analyze the stage of the disease, avastha Vashay Chikitsa clear, then give specific treatment. The total principle, a protocol I can say, do the Bala Rakshana of the patient. That result. It is the whole good for all the growths from esophagus to all the intestines or liver, pancreas, everywhere growth. This treatment modality you can utilize. Then coming to infections and degeneration, the degeneration of this one, Mrita should be done, given. And for infection, definitely Prakriti Vighat Chikitsa and Rasayana Chikitsa should be done. And another thing in such kind of esophagus, one is hiatus hernia and another one is GERD. Both conditions should be treated as a Udavarta. The drug I utilize usually Vaishwanara Churna with Sushekar and Kamudagutta. So Pittahara Vatanuromana or Kafara Vatanuromana, both Kafa Pittahara Vatanuromana, this Chikitsa should be done. Vaishwanara Churna is the drug of choice for all the cases of hiatus hernia. Patient comes with Udavarta Lakshana. There will be regurgitation of the acid. There, from tomorrow itself, you people can utilize this as a Vyadihara Chikitsa, Vyadi Viruddha, that is Vaishwanara Churna. And according to dosha, you utilize Kamadeva Mukta or Arogyavartini or Agni Thundi like that. If it is Pitta Pradhana, Kamadeva Mukta and Sushekara. If it is Kapha Pradhana, Arogyavartini and Agni Thundi, like that you can utilize in your practice. Each person can utilize. Even Jirakadhyarishta can also use. But Vaishwanara Churna must be there. So, coming to stomach, again, the same presentation will be maybe growth or infection or degeneration. How they present you. One is there will be Agniman. Second one, they present with the Amla Pitta like diseases. Third one, there will be heaviness in the abdomen, burning sensation or pain abdomen. These are the presentation. Maybe gastritis or gastric ulcer, or there may be perforation of areas, there will be severe pain, vomiting will be there, chubby will be there. These are all presentations will be there. In all the things, you do a specific diagnosis. You can send the patient for the gastroscopy, can get a result, and accordingly in OP level itself you can treat. If it is a ulcer, ulcerative growth, or malignant, or just ulcer, or just gastritis, patient comes with the Amla Pitta and Agnimatya and loss of appetite, or severe pain, burning, different presentations. Maybe heaviness presentation, a kapha presentation, a burning presentation, pitta presentation, or shula, pain presentation, vata pitta kapha. These doshas will be there. If it is a Bruna, it is a Raktavarnamata condition, there may be infection also. Infection also can cause all these conditions. Or there may be degeneration and fibrosis of the duodenal end of the stomach, and there will be obstruction. Patient comes with the Annadrava Shuddha. Unless he vomit out completely, he will not have any release. These are all presentation will be there. Just the treatment is, if it is a Shula presentation, utilize Narikela Lamana and Sutta Shekhar Pas. Narikela or Hingu Ashtak. If it is only burning pain is there, utilize Yashtimadu Churna and Kamadada with Mukta and Sushekara. Sushekara is the drug of choice for all these diseases. According to dosha, other drugs can utilize. So dosha, vyadhi, difference. Then coming to another percentage, heaviness. Some patients comes with severe heaviness. Just after they feel very heaviness. Just utilizing Vashtaka Churna or Bhaskar Lavana Churna. Or if there is a regurgitation, utilize Vaishwandra Churna. That is a Prabhutamata Haritaki is there. It will have Anuromana and Samsana effect. But there is no heaviness or Kapha Lakshana, only Vata with action. Utilize Avipraktikara Churna. Pittahara Vata. So these drugs you can utilize this condition. If it is infection, specifically H. coli infection is there, just to utilize Tapyadaloha or Tamra Basma with these drugs. But because they present the same signs symptoms, usually by gastroscopy, by biopsy, they usually diagnose if there is a infection is there. Instead of giving modern antibiotic, just you give Tamra Basma about 120 mg daily. Patient gets excellent result. Sushekar, of course, it contains Tamra Basma. So I feel there is a degeneration, there is obstruction, should go for surgery. Because it's a Baddha Gudodara. If it is a perforation, Parisravidara, go for surgery. Because Parisravidara surgery is told. And if there is no obstruction or perforation, you can give Ayurveda treatment. The Shodhana Chikitsa is, I prefer Sadyomana and Sadhyo Virechana, then the Rasayana Chikitsa. The very good Rasayan in this condition is Kushmanda Rasayan. Or some Grutas, Shatavadya Gruta or Mahatikta Gruta. As a Rasayana, you can utilize afterwards. Then coming to next is duodenum. Again, infection I have already told, degeneration also I told, growth also told. Here also ulcers will be there. The treatment protocol, whatever you adopt for stomach presentation, same thing will be there. But only thing in the duodenum, this one, patient comes with Parinama Shula. Parinama Shula means they get pain after complete digestion of the food. In empty stomach, there will be severe pain. Whereas in stomach ulcer, pain will be there just after food. Whereas in a duodenal ulcer, pain will be after digestion of the food. That is a Parinama Shula. In this condition, what I find out, instead of giving modern drugs like pantoprazole, all these things, if you utilize Balamula, Dashamula, Kshira Kashaya Basti, all these ulcers will heal. Before advancement of this modern anti-ulcer drugs, in Western medicine, they used to do gastrojejunostomy. In many patients, it is a common surgery in all the OTs, modern OTs, about 40 years back. Now, of course, after advancement of ranitidine and pantoprazole, it's almost now nil. Such conditions, if you utilize Dashamula, Balamula, Kshira Kashaya Basti, Yoga Basti or Kala Basti, all these ulcers will heal without any surgical intervention. This is what we can avoid surgery with this Ayurveda treatment. In that state, if you do this Basti Karma, you may be surprised that such condition, it's a Pitta Sthana, you have to give Virechana, usually you think. But Basti Chikitsa is the drug of choice. It's a Samana Vayu Sthana. If you give the Basti Chikitsa, almost within a week, all the ulcers will heal nicely. You can utilize it. Then coming to disease of pancreas, what we get is one is growth. Of course, growth it may need a surgical intervention. From Ayurveda, there is Shastrakarma is the first line of treatment. Kshara, Agni and Bheshaja. If it is not an operable condition, if a patient comes to you, definitely utilize Rasayana Chikitsa. Specifically, let's say Pitta Sthanaja growth is there. You can utilize Ballataka Taila or other rasayanas, Pargo, rasayana, etc. But the patient presents with in all these things, degeneration or infection or inflammatory pancreatitis. Drug of choice, what I find out is Narikela Lamana. Just Narikela Lamana mixed with Vaishwanara Churna because patient presents with Udavarta Lakshanas and Amla Pitta Lakshana and Chardi and Shula. In these conditions, just utilize a Vaishwana Churna with Narikelavana, 50% and give to the patient half of teaspoon daily 3 times. Most of the patient responds. If his vomiting comes down, initially he may need a 1 or 2 bottles of IV fluid because if it is very severe vomiting is there. Once, because in that stage, you make him nil orally and give him some IV fluid, just IV fluid for making him nil orally, and give only Vaishwana Churna with Narikelavana once in 3 hours or 2 hours with the Sutta Shekhar Rasa and Agni Nandi. Slowly he will recover. No need of IV fluid afterwards. Within 24 to 48 hours, he will recover with the, without any other modern drugs. You can continue this drug continuously. You can reverse the pancreatitis. What I have seen in some cases, even if the serum amylase level went into 2000 also, they have reduced to the normal within 48 to 72 hours. These things can be adopted. If a patient comes with chronic pancreatitis, it's not what I am saying in the acute state. In the chronic pancreatitis, repeated pancreatitis once and while it increases and decreases, they come to us. You see, initial stage they go for a modern hospital, they get treated with the conservative management. After that, there will be recurrence repeatedly. In such patients, they come to us with the repeated occurrence of the pain abdomen or these things. They come to Ayurveda treatment. Is there any specific treatment we can prevent the recurrence of the pancreatitis? What I find out with this specifically Narikela Lavana with Vaishwanara Churna or Amaraki Churna, you get wonderful result. If it is a Vata Pradhana, give Vaishwanara Churna. If it is Pitta Pradhana, Daha is Pradhana, utilize Amalaki Churna with Yashti. Patient will recover. And in this kind of pancreatitis, some patient may end up with some diabetic complications. Today, Sanadi Gana Kashaya, Varnadi Gana Kashaya, with that, they will recover. Then coming to this one, liver pathology, one is cirrhosis, and there are many pathologies out there. In relation with gastrointestinal tract, we get cholecystitis, CBD stone, severe pain, cholelithiasis. If it is a multiple stone, better to do the surgery as a first line of treatment. Because if you give only drug to pitta virechina dravyas like ratukaroini, if you give, a small stones may come into the CBD, there will be obstruction of the common bile duct. The patient may develop obstructive jaundice. So in such kind, if when there is a multiple stone, small stones are there. If a very severe pain is there, spasm of the smooth muscles are there, utilize Narikela Lavana and Bhaskar Lavana Churna or Vaishwanara Churna. Naturally his pain will come down. If it is Pitta Pradhana, it's a Pitta Sthana, Vata pain will be there. Just to utilize, if it is Pitta Pradhana, utilize Sutta Shekhar Rasa, Kama Pradhana, utilize Arogyavati. This is the difference. One is Vata Kapha and one is Vata Pitta. Just to utilize, and Kamadud Mukta, if it is a more Pitta is there, Kamadud Mukta, Mukta Basma. Utilize, naturally the pain will come down. You can utilize Patoladi Gana, Patoladi Katpuro, Inyari Kashayas, or these drugs can be utilized. When there is a cholelithiasis, cholecystitis, CBD stone or obstruction is there. Definitely first line of treatment always for the obstruction is the surgical intervention. As a medicinal treatment, these things can be done. I am not discussing about Kamala, all these things. Anyhow, in infective conditions like Kamala may be there, viral infections, viral hepatitis may be there, or bacterial infection, cholecystitis may be there. In that condition, if it is bacterial, you need modern antibiotics because it's an acute state. But after acute state of infection goes, better to go for a surgery because there will be recurrence of infection. There is chances of biopsy, abhyantara vidrati, and perforation. This is all complicated. Patient goes into peritonitis. That is abhyantara visarpa. These are fatal conditions. Patient may end up with death. Better to go for surgical intervention at first place itself to save his life. But it is in a chronic state. Slowly, some diseases are there. Definitely, we can utilize Ayurveda treatment as a Shamana Vashadi. I think if it is Shula presentation, go for Narikela Lavana. If it is a Daha presentation, go for Sutrashekara and Kamdurmukta. And Vaishwanara Churna, Arogyavardhini. These drugs should be utilized. If it's a degeneration, like cirrhosis of liver, degeneration is there. If Avarana is there, you see, this degeneration is Dhatukshay Avastha comes due to Avarana. That is Chan. Vayu Dhatukshay Ko Margasya Avarana. First Avarana is there, Avarana, there will be Dhatukshay. Patient may come with any state. They may come with 90% or 10% Dhatukshay, 50% or 50% Dhatukshay, 10% or 90% Dhatukshay. According to Avastha, you can find out. If slight Avarana is there, first you go for Sadhyomana Hadevechana Shodhana Chikitsa, that is at least post Shodhana Chikitsa, then you give Rasayana Chikitsa. Already complete Dhatukshay degeneration occurs, there is no chances of recovery. But slight Avarana that can be removed immediately, patient recovers from the condition. The Shamana Vashadi you give with Gomutra Haritaki is the drug of choice in these conditions, specifically in cirrhosis of liver. Gomutra Haritaki. Haritaki with the Gomutra, if utilized, most of the patient will recover very nicely. But especially maybe alcoholic or other types of cirrhosis, Gomutra Haritaki is the drug of choice. You can utilize other drugs also, or according to as a Vyadhi Viruddha, I am saying, as a Dosha Viruddha, other drugs should be utilized. By that you are giving Dosha Vyadhi Viparita Chikitsa. Then coming to next condition, small intestine, all Ajirnas, Agnimadhya and Ajirana, they comes with this condition. Ajirna Harachi, patient presents with Shula and presents with Udavarta, presents with Lavitta. In all these they present with all these conditions. They come to us. If it is surgical condition like Bandha Udodara and perforation, that may be there. Infection may occur with appendicitis or other infection into the intestine. There may be growth. Gulma may be there. So Sannipathaja Gulma nothing but a malignant condition. Ekadoshaja Gulma is single growth may be there, or just growth like a situation may happen. And Bandha Gudodara may happen. These are the surgical conditions. What we can have a OPD level treatment. First in OPD level treatment is you should able to find out is it a surgical condition or is it a medicinally treatable. Once you think it is a medicinally treatable, then you should think according to Ayurveda. A Shula Pradhana will be always Vata Dosha will be there. Is it Ekadeshaja, maybe Raktavarana Vata will be there. Maybe due to infection, or maybe allergic, or maybe Ajirana. All this can patient presents with Shula. If it is Ajirana, give Hipvastaka Churna and Agni. It's a drug of choice. Definitely you can get a very good result in this drug. And Narikela Lavana. If it is Pitta Pradhana, utilize Sutasheka Prasad. That's what I am saying. Also, Rasaushadis, utilize it in your practice. Definitely, in most of the cases, will get excellent result. The Arishta is Jirakadhi Arishta. In such kind, Jeerakardiarista is a drug of choice, or Takrarista also you can utilize. But I am using Jeerakardiarista. I think most of the cases I get excellent result with the Jeerakardiarista. Bhaskara Lorna Churna is there. That also can be utilized. And degeneration, of course, due to our there may be degeneration. Again, patient presents with some obstruction of this condition. Then surgically it should be excised. There is no other way. Coming to large intestine, patient comes with Atisara and Pravahika. And also flatulent abdomen or Shula, Udavarta, Arti, all these presentations may be there. It may be Baddha Gudodara, it may be Parisravudara, or it may be infection, maybe appendicitis or other infection conditions. It's all our presentations. First, you should, as in a clinic, when you sit in the clinic, they come with Shula or Udavarta or Gulma. You should find out whether it's treatable with the medicine or surgery. Definitely, you should take a clinical examination to do, then go for sonography or X-ray. These things you find out what is it. If it is surgically, definitely go for Shastrakarma. If it is medicinally treatable in a OPD level, the drug of choice will be, if it is Atisara, again you should see according to dosha. There will be loose motion. You see, in Atisara you see, it's a Pitta Pradhana Vedi, Pittasya Apya Mahabhuta increases, you get Atisara. Agneya Mahabhuta increases, you get Jara. When Apya Mahabhuta increases, you get Agnivantiya and Atisara will be there. The drug, it's only Pittaja, there will be severe Atisara will be there. If it is Vataja, there will increase frequency, but hard stool will be there. If it is a Kafaja, the Atisarana of the Mala with the mucus will be there. Again, it is a Ama or Nirama. You should diagnose it, and a specific drug should be utilized. The drug of choice, if it's a Kevala with a severe Atisara, may be due to infection, like amoebic dysentery or bacterial dysentery, gastroenteritis. It's all acute state. Definitely, you may use IV fluid and Amastambhana Dravyas can be used, and modern antibiotics should be utilized. If it is in a chronic state or repeated, definitely it's a field for Ayurveda. They come to us with these kinds of symptoms. What I utilize is the drug of choice is Kutaja Ghanavati. Kutaja Ghanavati. That is a best drug at Agnitundi. And Kutaja Barpati. Dadimastaka Churna. So in the large intestine, then small intestine, I come to Dadimastaka Churna. Then upper GI, I utilize Vaishwanara Churna. Lower GI, utilize Dadimastaka Churna. And Sutta Shekara is in upper GI, but lower GI go for Agnitundi. So differentiation will be there. Because Ajirana is more happening in the lower GI, in upper GI, Agnivantiya. So definitely the upper GI usually Pitta is more involved, lower GI more Vata involvement. So Agnitunde utilized. In the upper GI, Sutta Shekara and Kamadeva Gupta is utilized. In lower GI, specifically more of Vata involvement. It's a Vata Sthana, what Charaka says. So Agnitunde and Dadimastaka, Hingvastaka, Bhaskar Lavana, these are the drugs. Kutajarishta, Mustakarishta, these are all drugs utilized. There are many other drugs are there. Kapita, Ashtaka Churna is there. What I say, Dadimastaka Churna is there. Or just take Dadima, whole Dadima, make a juice with Takra and give to the patient. You get excellent result. These are all, I can say excellent result, but in a presenting patient, you should diagnose which dosha involved, and for a Vyadi, I can say which dosha involved, like that, you should take Anupanas and according to should be utilized. In the Rasavashadi, drug of choice for this large intestine disease is Varpati Kalpas. Rasavarpati or Panchamrita Varpati or Kutaja Varpati. can be given as a rasayana dose in increasing phase and decreasing, like that also you can utilize, or otherwise also you can utilize it. The other diseases we get in the large intestine, ulcerative colitis and Crohn's disease. I think in the modern system of medicine there is no answer for this. If it is an infection, modern system has answer, that is antibiotic. If antibiotic is not there, there is no answer in modern system of medicine for these diseases. It is for Ayurveda. In Ayurveda, it's autoimmune disorders. Definitely, drug of choice, what I say is Yashtimadu and Musta. It's a kashaya should be given without adding milk. He should avoid moong dal, all these spinac, these things which have more fibers. These things should not be given such conditions. And the Shankhavati, these drugs if you utilize, most of the cases of Crohn's and ulcerative colitis can be cured. As a Shodhana, you give post Shuddhi by Sadhyomana and Sadhyavirechana, give as a Rasayana, Yashtimadu, Kashaya, utilize it. Definitely these are the diseases can be cured. I think I have covered almost all the diseases of gastrointestinal tract, from Mukha Roga. Another is that Chardi, I think I have not told. Chardi is really a tricky situation. When a patient comes with the acute state of Chardi, I think we have to utilize modern medicine, because whatever drug I give is all omitted. Patient can't respond at all. Anyhow, if it's more of Kaphaja Chardi, utilize Ardraka Swaras. And more of Vataja Chardi, more sound and only omitting. And then utilize Mayura Pichabhasma. It has excellent action, Mayura Pichabhasma. Another disease I think I have not narrated here, that is Hikka. In Hikka and Chardi, Mayura Pichabhasma is the wonderful drug. Usually Hikka occurs due to irritation to the diaphragm. Diaphragm is irritated due to gastritis. Patient gets Hikka. Maybe by central nervous system irritation, in a patient of stroke or CVA, in the end stage, they will have severe Hikka. Even by MI or pneumonitis or gastritis, whenever there is irritation of diaphragm, patient will have Hikka. That is Samuthana Vishesha. Even the modern way of understanding of Samuthana Vishesha, if you understand what is, how it occurs, then specific treatment can be given. If it is a MI is the cause, go for MI Chikitsa. If it is pneumonitis, go for Vasa Chikitsa. Infection is there. If it is a gastritis, no infection, only gastritis, acidity is there. You Amlapikta Chikitsa. For Chardi also, these are all causes. Pneumonitis, your cardiac condition, or gastritis, or intestine conditions, all these things, or a Shula, Udavarta, when Vyanavarta Apana, you will have Gulma, Asti, Parikartika, Chardi is the one of the Vami, Atmana, Udavarta. These all symptoms will be there, classical sign symptoms. Vami, Atmana, Udavarta, Gulma. These things occurs in a tract. Because all Anuloma occurs due to Apana Vayu, whereas Prasarana Akunchana occurs due to Vyana Vayu. When Vyana Vayu becomes powerful, Vyana Vrta Apana, you will have Vami, Atmana, Udavarta, Gulma, Arti, Parikartika. All these signs and symptoms will be there. For the Chikitsa, he says Tikta Anulomana should be given. But if it is only Kevala Vata, if Kapha and Pitta Samsarga is there, then Kaphahara or Pittahara Vata Anulomana Chikitsa should be done. So, I think when severe Chardi is there, you may need IV fluid and anti-emetic drugs, modern antibiotics, because it can be by injection you can give. One dose may be sufficient. Once you start to give your medicines inside, then your medicine start to work. No need of this modern anti-Chardi medicines. But if patients are able to take your drug, then Chardi may reduce. But in all the cases, I don't say we can get a successful result. But in Mayura Pichabhasma and Ardraka Swarata, you can have very good result. And another, Kevala Vataja, a psychological origin, I think this Madi Pala Patra Kashaya. This is a wonderful drug. You can utilize it for treatment. Or Mrittika Kashaya. that also works wonderfully. By smell of the mritika, mud, patient gets relief from vomiting. Recently, I had one patient have so much powerful vomiting, but to only sound, there is no material coming. Let's say, Kevala Chardi. Patient was treated with all modern anti-emetic drugs. She didn't get any result. Then what we did, we gave old pots, piece made into kashaya, and I gave patient gets immediately from vomiting. This is a wonderful treatment. So sometimes it gives excellent result. Usually in the Buddha Vaidyas in villages, they give this treatment. For I think all other conditions I have told you. So if you have any questions, I think one is Grahani is there. The Grahani I will tell you. In the modern perspective, as a anatomical aspect, we can't explain Grahani, but from a physiological aspect, from working pattern of the intestine, you can say Grahani. You see, Grahani is a Vata Pradhana Vyadhi. What is the signs and symptoms of Grahani is Murbadda and Muhurdrava. It is usually people think that it's a Kavaigunya dosha is Pitta. Actually, Kavaigunya dosha in Grahani is Vata dosha. Why it is so? In Atisara it is a Pitta, but in Grahani, Kavaigunya dosha is Vata. There is a difference between Grahani and Atisara. In Grahani, there will be Murbadda and Muhurdrava is Atma Lakshana. Why this Murbadda and Muhurdrava occurs? If you take rice to boil, it takes about 10 minutes. Agni is there. You put rice with water on the in a pot over the Agni. If you keep 10 minutes, it nicely become a paka. If you keep it only 5 minutes, it will be drava. If you keep it more than 15 minutes, it will become dry. So, how much time you keep on the fire decides, is it Murbadda or Muhurdrava? So, time is managed by Vata dosha. So, that is why Kavaigunya dosha in Grahani is Vata dosha. So, that is why Charaka usually says to give grutas. Specifically, Changerya gruta or Shatpala gruta. This is a wonderful drug for Grahani. Many of the patient comes with the Grahani. I think usually we diagnose ulcerative colitis as Grahani. Ulcerative colitis is not Grahani. Ulcerative colitis is a case of Raktatisara or Crohn's disease of Raktatisara. In the Grahani, in the ulcerative colitis, there is the continuous loose stool with blood and mucus. Whereas in the Grahani, Murbaddas, sometimes loose motion will be there. And such a presentation is there. Usually it occurs due to Agni Mandya, variation of Agni and variation of the Samana Vayu, it occurs. So give Gritas, specifically Shatpala Grita and Changerya Grita, it works wonderful in such conditions. So if you utilize, you can cure the Grahani. So, and Ingo Ashtaka Churna or Bhaskar Ravana Churna, these drugs can be utilized in your treatment according to presentation. Say, Kevala Vata may be there, Pitta Samsarga may be there, Kapha Samsarga may be there, according to involvement of dosha. Utilize a specific drug and give treatment. But Druta is the drug of choice in such conditions. It's in OPD level. These are all many drugs I have told you. Many of the things I have told, many of the I may not tell everything because according to presentation, you see, you have to utilize these drugs. And Sadhyomana Sadhya Virechana in all these conditions is excellent Shodhana Chikisa. No need of classical Amana Virechana. Just you give Sadhyomana Sadhya Virechana, get Kosh Shuddhi, so that there will be Agni Dipti, then you can utilize this Dravyas and Rasayana drugs. Utilize. Definitely you can get a wonderful result. So with this, I conclude my presentation. Hetu Linga Vishadam Jnanam Swastha Prana. Patient comes with the Linga. You have to see what is Hetu. That you have to give Aushadam. That is why Vagbhata says, Dushyam desham balam kalam adalam praktam vaya sattam satyam aharam avastasya sukshme sukshma pariksha. Dosha nirupana first. Dosha ausha nirupana. After doing dosha nirupana, give the aushada nirupana. It is a physician's domain. Swayam diya uhya. With your own intelligence, you do uhana. By analyzing signs and symptoms, you see which dosha involved and where is this, what is samuthana vishesh, how this samuthana occurs, and what is this anasamshaya. Patient may comes with the same symptoms. So amla pitta symptom may be there, but anasamshaya may be large intestine, small intestine, or a gallbladder, or maybe pancreatitis, or maybe amla pitta, or hiatus apnea. All these presents with all this samuthana vishesh. So that and sthana samshaya, these two things you should understand. That is, Trivida Bodha should be there before giving a treatment. Even in OPD level practice or in IPD level practice. Don't think IPD level, OPD level different. Everywhere you have to find out these Trivida Bodha should be there. After that, you should give specific treatment. So that is why there is no roga without dosha. After analyzing dosha, anuktamapi or uktamapi, see dosha linga in a given vyadhi, give specific treatment. In the conclusion of what I am saying, if students are there, Satata Dhyana you do, and Vada, that's a discussion. So this transfer of knowledge will be vertical and horizontal. Vertical by Adhyana, Vada there will be horizontal, Paratantravalakam horizontal, whereas Sadvidhyachara Seva, both vertical and horizontal transfer will be there. So daily you are having discussion, horizontal transfer, and also there will be vertical transfer of the knowledge. With this understanding, I will conclude my presentation. Thank you very much for giving this opportunity. Thank you very much. If you have any question, you can ask.
First of all, sir, thank you so much for this wonderful session. You have in detail explained from the mouth till the anus all the diseases. I hope that is the perfect meaning of what is gastrointestinal disease management. Thank you so much, sir. So, with your permission, we have few questions in our chat box. Can we go for the discussion, sir?
Yes, definitely. You can ask.
Okay, sir. So, we have the first question from Dr. Inderjeet. He is asking, he have a patient with complaints of moderate hepatomegaly with mild pain, right hypochondric region with excessive gas formation. And the patient was alcoholic before. Now he is not taking alcohol, but has complained of pain in the right hypochondric and decreased appetite. Can you please suggest the line of treatment, sir?
So this is a very good question. Here, you see, what may be the cause you have to think. If it is done a sonography or if you do a blood investigation, definitely you will understand. Is it a cirrhosis of liver due to alcoholic cirrhosis of liver, or is just indigestion? These things can be diagnosed. If you see SGBT, SGOT level, then also you can understand. Is it there will be change of the metabolic changes. In all these conditions, drug of choice is Gomutra Haritaki. If you utilize Gomutra Haritaki with the Arogyavardhini, such patients respond wonderfully. And Nitya Virechana can be given with the Eranda Taila with the Gomutra Haritaki. I think this should be line of treatment. And if it is Shula is there, give Shula Hara Achisa like Hingvastaka, Narikela.
Okay, sir. Inderjeet, if you want to ask sir something, you may do so.
Yeah. Good evening, sir.
Yes, good evening.
So the same patient has complaint of bleeding piles intermittently. And he has a ultrasound with 17 centimeter of liver and moderate hepatomegaly, sir.
Yeah.
I think, sir, he has not cirrhosis, but it is moderate hepatomegaly.
Okay.
Yes,
So, yeah, I got it. If say bleeding piles is there, the piles should be treated. Otherwise, patient may went up with severe anemia. It can be treated with the Ksharakharma or ligation by rubber banding. Both can be done. After that, you should give treatment for this one. Nitya Virechana you give with Gomutra Haritati. Definitely patient will respond. That should be a line of treatment. First, I think that bleeding should be stopped. Otherwise, by Nitya Virechana, there will be bleeding daily.
Okay, sir.
Motion, every time there will be bleeding.
Okay, sir.
First, tackle with that hemorrhoid condition. Then
Okay, sir.
Nitya Virechana. Patient will respond such cases.
Thank you, sir.
Yes.
Thank you, sir. Now we have the next question. Sir, vitamin D and vitamin B12 deficiency. How to treat this using Ayurvedic kalpas?
Vitamin
Vitamin D and B12.
D and B12.
Yes, sir.
I think we should not think according to that by Ayurveda treatment. You give Satyavamana Satyavirechana and give Agnimandhyahara Chikitsa, then give specific drugs like Grutas and specifically I think Shatpala Gruta and Mahatikta Gruta or Kalyana Grutas. They will respond very nicely. But if pernicious anemia is there due to then the B12 deficiency, he may be needed injections. We can't treat. But otherwise, all these conditions can be treated, specifically with the Grutas.
Okay.
Buddhitikta Gruta or Mahatikta Gruta. If utilize it, vitamin D deficiency can be tackled.
Okay.
Yeah.
Sir, this was asked by Dr. Ujjwala. Ujjwala, do you want to ask anything specifically regarding this question? You may do so. I hope she's fine with the answer. So we'll go on to the next question, sir. From Dr. Sairam. In follow-up, should the medicine be changed as per dosha changes after few days or give Vyadhi Viparita Chikitsa for few months like in Amla Pitta?
Amla Pitta also not only Vyadhi. In Amla Pitta also Vataja, Pittaja, Kaphaja presentation will be there. And all any Vyadhis, according to stage, there will be change in doshas. So that is why in IPD daily we are doing the rounds morning and evening. If any change in dosha presentation, we will change the drug. In the OPD level, that is a patient comes once in a week or once in 15 days. In a chronic patients or daily in acute state. Whenever there is a symptoms changes, that means there will be change in the presentation of the dosha. Accordingly, drug should be changed. So in Amla Pitta also, don't think the patient may come with the severe Pitta Pradhana, Urdhvaga Amla Pitta or Adhoga Amla Pitta or maybe Vata Pradhana or Pitta Pradhana or Kapha Pradhana. In Kapha Pradhana, there will be heaviness will be there. In a Pitta Pradhana, severe burning. Vata Pradhana, there will be severe pain may be there. So drugs will be changed. You can give Sutta Shekara, you can give Akti, you can give Kamadeva Mukta, or you can give Vaishwana Churna or Hingvashtaka Churna or Avipattikara Churna. According to presentation, drugs should be changed. In Ayurveda, he never, Sushruta or Charaka never tells you should give same drug continuous for 1 month. Same drug you give as a Kala Basti or Karma Basti, same Basti you give, not like that. That is why you are seeing the patient daily, morning and evening. Or once in a chronic patient, OPD, once in a week, why patient comes here, you can write today itself a drug you take for 3 months. It is not possible like that. According to presentation, which dosha involved, like that you have to change. Then that is why Charaka says avastha vashena chikitsam kuriyat. Desha kala bala avastha. That should be decided by swayam diya uhya. Each physician with its intelligence, they have to do uhana. That is a creativity of the individual physician. Even though 15 students learn in the same class, each Vaidya will be different according to his own uhana. Some person will excel in their practice, some person may not excel at all. So who have that creativity, they will excel in their practice. That is the beauty of Ayurveda. Medical practice beauty itself is lifestyle. Okay.
Right, sir. Right.
I think I have answered your question.
Yes, sir. Sir, also can I ask you about the Apunarbhava Chikitsa of Pittaja Agnimandya?
Pardon?
Apunarbhava Chikitsa of Pittaja Agnimandya.
Apunarbhava?
Chikitsa of Pittaja Agnimandya. Any kalpas that you would like to give in Pittaja Agnimandya condition?
In any condition you see which dosha involved, like that you have to treat. In the Pittaja Agniman, there will be severe burning sensation will be there. In such conditions, I think the Udumbara Kashaya, Kshira Kashaya, works wonderfully in such conditions. I have seen many patients. And another thing is, if it is in a Pittaja condition, if Vata Samsarga is there, you give Shatavari Grita. That is wonderful. If it is a Kapha Samsarga, give Mahatikta Grita. Like that, you change and give the Gritas. Gritas are drug of choice in such conditions.
Okay.
That will work wonderful. Yeah.
Okay. Thank you, sir. Next question from Rupa Rawal. A non-alcoholic fatty liver with pain and hepatomegaly. What should be the line of treatment?
No, any liver condition, treatment should be given according to Yakrudodara. Maybe alcoholic or non-alcoholic.
Okay.
The drug of choice is Gomutra Haritaki and Nitya Virechana. And the fair number of cases you get good result. I don't think every case you can cure. And but there may be presentation differ. Some person may end up with Jalodhara, some person may end up with Kamala may be there, associated symptoms. Like that, you should give the specific treatment. So you can't say same treatment for everybody. Some person has already one case here told there will be severe bleeding for rectum. There may be esophageal varices bleeding may be there. So many complications are there. All these things you utilize and give the specific treatment. If you give Gomutra Haritaki, when there is a severe bleeding is there, bleeding will increase.
Right.
So after tackling that only you can give these drugs. Otherwise, by giving Gomutra Haritaki itself, there will be severe bleeding. So we should each case individual patient's presentation like that analyze and should be given. So I think I have answered your question.
Yes, sir. So next question. What treatment can be planned for tongue fissure with discoloration? Tongue fissure with discoloration. What treatment?
It is a Vata Pitta condition. Yashti Madhu and Amalaki Churna with Grita, if you utilize such conditions, will be cured. And Kamadu with Mukta can be utilized along with that. It should be mixed with Grita and given to the patient. Specifically in Vata Pitta conditions, always Shatavari Grita is the drug of choice.
Okay.
Patient gets the relief. Yeah.
Okay, sir.
And another thing, this condition, Mokaroga, you can give him Narikela Taila for gargling daily, once or twice. Such conditions will recover very fast.
Okay.
Yeah.
Sir, what will be the treatment protocol that can be planned in case of irritable bowel syndrome?
Irritable bowel syndrome. Very nice. Very good question. I think I have not tackled this condition. Usually it is a Vataja condition. Vataja, it comes with Vataja Atisara. And also another one is Bhaya Atisara and Shoka Atisara. This comes with irritable bowel syndrome. The drug of choice I usually utilize is one is Manasa Mitravati, Ekanga Virarasa, and Yashti Madhu plain Kashaya. Give along with the Musta. Yashti Madhu Musta, plain Kashaya, along with the Ekanga Vira Rasa and Manasa Mitravati. Such patients respond very well. in most of the patients respond very fast. You can utilize it. But according to other involvement of doshas, you may have to change. If Vajrana is there, you can give Agni Dundi or Dadimastaka Churna or some other drugs may be needed in initial state. Once it is at Ajirana status gone, then you start give these drugs. Yashtimadu Musta Kashaya and Ekanga Veera Rasa and Manas Mitravati. Such patients respond very fast. That can be done. Yeah.
Okay, sir. Sir, next question. Treatment for Crohn's disease.
I think I have already told. Crohn's and ulcerative colitis. It's autoimmune conditions. Yashtimadu Musta plain kashaya milk. Patient should not drink milk. And Shankhavati. These two drugs are sufficient in most of the patients. And some other drugs associated symptoms like that, utilize Dadimastaka or Parpati Kalpas, specifically Kutaja Parpati, or Swarna Parpati or Vijaya Parpati. These things can be utilized. Whenever autoimmune conditions there, Swarna Basma included drugs works wonderfully. These things can be utilized. Yeah.
Okay, sir. Sir, can you please suggest the treatment protocol for diverticulitis?
Diverticulitis, anyhow, how they present like that, it is there. If there is a perforation or these things, you should go for surgery. But otherwise, the treatment should be given according to presentation. If a Shula presentation is there or Ajirana presentation is there, treat accordingly. I don't think it's a diverticulitis there is a specific drug is not there. According to presentation, drug of choice is Agnitundivati. Agnitundivati works wonderfully in such conditions. Even in appendicitis also, a patient comes with appendicitis, chronic recurrent appendicitis, just to give Agnitundivati continuously, they respond very nicely. And you can use Raktamokshana also by Jalavakavacharana. Fair amount of appendicitis reduces because Raktavarana is there. When the Raktamokshana is immediately, the pain and these things symptoms will reduce. And Agnitundivati is the drug of choice in these conditions. Yeah.
The place for Raktamokshana, sir? The area.
Area, it's a Gambhira Jalavaka. That is a Jalavaka should be utilized. In that Hastamatra area of the Rakta is removed. And that right iliac region only you have to put the Jalavaka.
Okay.
That's what. Yeah.
That's a seriously. That's a new information, sir. That's why I just.
Yeah, definitely you can utilize it. In initial state of immediately patient gets relief.
Okay.
I don't say it is a parallel to surgery, but if the perforation is there or obstructive appendicitis is there, definitely you should go for surgery. But it is not obstructive appendicitis, definitely it will reduce. It can be tried in if it's a remote place, there is no surgery, surgeon is not available. In such a condition, if you put the Jalavaka, patient gets very fast relief from his pain. If it is a non-obstructive worry, if it is obstructive, definitely you should go for a surgery. Otherwise, there is a perforation or a gangrenous change may happen. So, anyhow, it is one possibility is there. I think all the physicians can have in their mind. Yeah.
Right, sir. Right. Yes. Sir, a treatment protocol for recurrent stomatitis.
Stomatitis.
You have.
So already I have told you, Mukarogas. Same Amalaki Yashtimadu Churna, Suchekara. If it is due to Agnimandya Hara Chikisa should be given. Don't think only Vata Pitta is there. Kapha Pitta may be there or Agnimandya may be there. That should be treated accordingly. Then only you get result by stomatitis. Yeah.
Sir, another question. I think. Can you please give a brief account about the Grahani Chikitsa? All this is part of Grahani Chikitsa.
I have told you once.
Yes, you have already described about this, but I don't know whether she.
You see, in most of the Grahanis, usually what I see in many of the Ayurveda physicians misdiagnose the case of Crohn's disease or ulcerative colitis as Grahani. instead of comparing a modern disease into Ayurveda, you take Grahani as itself. How the patient comes with these symptoms of Muhurbadda Muhurdrava is there for any patient. Continuously there is a Muhurbadda Muhurdrava with all symptoms of Amlavitta or Agnimadhya and heaviness, Udavarta. These symptoms will be there. These are independent disease also. These are all symptoms of Grahani. One is independent disease, another is these are all Amlavitta, Udavarta, Gulma, and these things are symptom of Grahani. Like that also they present you. So just to diagnose it Grahani. If what is Atmalakshan of Grahani, there will be Muhurbadda and Muhurdrava is there with these symptoms. Then diagnose it accordingly. But Krita is the drug of choice. First, what I do, whatever patient comes to me, I suggest them to undergo a Sadhyomana and Sadhya Virecha. It can be done in OPD. Just to give ST Badu Panta, just about 3-4 glasses. After taking 2-3 glasses of hot water, just to give him ST Badu Panta. If there is a dosha uklesha, he will vomit out immediately in front of him. Once its vomiting is over, then give him a slight kanji, all these things. Next day, give him Eranda Taila with Gomutra for Virechan, Sadhya Virechan. He will pass 2-3-4 stools, loose motions. Then once his Kosha Shuddhi occurs, there will be Agni Mandya Gona, Agni Deepti occurs. When Agni Deepti occurs, start him Grutas, specifically Changerya Gruta or Shatpada Gruta. Patient will recover, most of the patients will recover. As a Rasavashadi, Agni Dundi, Sushekara or Aragyavardhini, accordingly, if it's a Kapha Pradhana Aragyavardhini, if it's Vata Pradhana Agni Dundi, if it's Pitta Pradhana Sutashekara Rasa. Just you give, such patients will recover very fast. I think I have given you
Yes, sir.
the treatment protocol.
Yes,
Yeah.
very beautiful explanation in the capsule form. Thank you, sir. Sir, what can be the drug of choice to increase the intestinal absorption?
Eh?
What will be the drug of choice to increase the intestinal absorption?
Which have absorption.
Yes.
I think Agni Dundi is the best drug.
Okay.
Agni Dundi, yeah.
Okay. Sir, medicine for Chatti in pregnancy.
I think Mayura Picha Basma and Kamadoda with Mukta.
Okay.
These two things can be utilized in pregnancy.
Okay.
And Madi Palarasayam syrup.
Okay.
3 things can be utilized.
Sir, Arsha's treatment.
Asha, I think next week there is a treatment for Purusha Slotas. I have told you already.
Okay.
I will discuss all Purusha Slotas Vyadis next week.
Right, sir. Right.
Yeah.
Sir, Ayurvedic treatment for hepatitis B.
No, hepatitis B, hepatitis A, B, C, D, E, F, anything comes under Kamala Chikitsa.
Okay.
There is no specific for hepatitis B. Like that, not there. Give Kamala Chikitsa, you get relief. In acute state patient presents, you can make it HBsAg negative by Ayurveda treatment. But it is a non-inflammatory state. It's a dormant state. It is very difficult. I don't think we can cure it. Yeah.
Okay, sir. Sir, is there any kalpanas to prevent appendicitis?
Appendicitis, to prevent.
Yes.
How you can give continuously for a normal person?
Like, sir, if a patient comes with a pain in the mass, in the McBurney's
So
point.
after coming, you have to treat it as how they present.
Okay.
But how to prevent it? For a healthy person, can you give a drug like that continuously?
Right.
It is not possible. But I think their question may be for recurrent appendicitis. Once appendix happened, then it subsided. After 3-4 months, again the recurrence occurs. For such cases, if you give Agni Dundi Vati, there is no chance of recurrence afterwards.
Okay. Okay.
That can be done.
Sir, in reflex esophagitis treatment.
It's Udavartahara Chikitsa. I give Vaishwanara Churna is the drug of choice.
Okay.
Yeah.
Sir, treatment protocol for antral gastritis. Antral.
Okay. Any gastritis, you give Amlapitta Chikitsa. There is nothing like this gas or that gas. According to anatomical specificity, there is no Chikitsa. How they present you with dosha analysis and sthana analysis, you give the treatment. It's already I have told Amlapitta.
Sir, patient having multiple aptoid ulcer in sigmoid colon, rectum. Please mention more Shamana Ushadi apart from Musta and Yashki.
For what purpose?
Aptoid ulcer in sigmoid colon and rectum.
Sigmoid colon and
Rectum.
no, it is usually occurs due to ulcerative colitis or Crohn's diseases.
Okay.
I think ST Musta plain kashaya is the drug of choice. So patient respond very nicely in such cases. If it is a case of malignancy, just you go for Arbuda Chikitsa, Shastra Kshara Agni-Veshita. Like that you have to go. But patient presents with loose motion and Rakta, give ulcerative colitis Chikitsa. That should be done. If it may be solitary ulcer syndrome may be there or multiple ulcer syndrome. So give same line of treatment. Or you can utilize Parpati kalpas. Parpati rasayanas can be given. One rati, 1 day, second day, 2 rati, third day, 3 rati, 4 rati. Like 10 days you give, again a reduced dosage with takra as a takra anna as the patya bhojana. Many of these things can be cured. I don't say everyone will be cured because according to presentation, person to person that will differ. Like that, the result may differ. But definitely it gives wonderful result. You can utilize it in our practice. That's what. Yeah.
Okay, sir. Sir, some patients complaining of burning sensation and sore irritation. Some complaining indigestion. And some patients having both the presentation. So what should be the drug of choice in all these 3 conditions together?
Then only severe burning, it is Vata Pitta condition. You Sushekara and Kamadeva Mukta. When indigestion, there will be heaviness, all these things. That's a Vata Kapha condition. Utilize Agnitundi and Vaishwanara Churna or Hingvashtaka Churna. Sometimes all 3 will be there. And the Agnitundi, Sushekara, Kamadeva Mukta and Vaishwanara Churna. All the drugs should be utilized according to percentage of the presentation. And Patya, patient should follow the Patya. That indigestion things with Amlapitta, that usually occurs due to Agnimandya and Ajirna is the cause. Whereas in the first these things there will be gastritis may be caused. So it is not the same area. The Sthana Samshaya area may differ. One is Pitta area and Vata area. So like that drugs may be differ person to person. That's what you have to do.
Okay, sir.
Yeah.
Sir, in case of asymptomatic patient having slightly increased SGOT and SGPT, is treatment required or not?
Better to give, just to give Palatrika Kashaya is sufficient. They respond very nicely.
Okay.
That may be Pura Rupa of any future disease like Kamala or this one, Yakrutoda.
Okay.
Sometimes patient presents with fatty liver without any symptom. By sonography, you will find out.
Okay.
That is actually with the help of modern diagnostic gadgets, we are finding out in the Pura Rupa Avastha.
Okay.
Just give him Palatrika Kashaya or Aragyavardhini, these drugs continuous for 1 or 2 months. They will respond very nicely. Can be cured. Yeah.
Okay, sir. Sir, how to clinically differentiate Amla Pitta and Vidagdha Ajirna?
I think in Amla Pitta also there will be Agnimandya. In Vidagdha Ajirna also Agnimandya. Drugs are same. There is no need to differentiate for the academic purpose. Practically, we are treating both conditions as a same. In a Pittaja, Amla Pitta or Vidagdha Ajirna. In Ajirna Avastha, you have to give Chikitsa for more of intestinal area. Without the this one Namla Pitta, there is more of gastric area treatment should be given. More of one is more Pittahara and one is more Vata Kapara Chikitsa should be given in Ajirana Avastha. So that slight differentiation is there. Just to utilize, should you use Avipattikara Churana or Hingvashtaka Churana? Should you use Vaishvanara Churana or Bhaskar Lavana? Like that, there is a differentiation. Lavanas are used more for this one Ajiranas, whereas this sugar is used for in more of Amla Pitta. This that difference is there. Slight difference. That is why Swayam Duya Uhya. You have to do your own creativity. Do it treatment. I think here by sitting in a AC room, I can't tell this drug, like that. You can't compute it. In that particular situation, individual Vaidya should decide what should be given. These are all broad area. These protocols are given. It's just like mathematics. You see, in mathematics, there are theorems are there. We by heart all the theorems, but individual patients are individual problems. For each problem, you are utilizing one theorem and solving the problem. So patients are different problems, and utilize the theorems whatever learned in class. Utilize it and solve each problems. So you can't by heart these problems. You can by heart the theorems. So utilize it and practice.
Right, sir.
Yes.
Sir, another we have a case discussion. Dr. Pooja has written that she has a male patient with age of 18 years old, having complaints of abdominal pain, having stools after eating anything, depression, male pattern baldness is started, and recurrent stomatitis and loose motions. Patient is Karshia, history of